Can you tell us about, and I'd like to show you first the slides that were presented by Professor Raoud on the May 19th, and essentially what he explained on those slides is that if there is no early treatment, the likelihood of having young people suffering from the disease is much higher, and mortality including. Can you explain what's your message to young people and how you deal with young people, at the testing, at the diagnosis stage, etc.?
The only way by which I've been able to bring young people to events that I have organized for testing has been to bring, musicians or people that they can identify with. Young people believe that they're invincible, that nothing will happen to them. And the fact is that young people are equally sick as old people. And I have seen a lot of young people outside the hospital setting drop dead because they thought that, it was just a common cold or it was nothing. So the message to the young people would be, make no mistake. We have two kinds of people in this world, those who have COVID and those who are gonna get COVID. And sooner or later, we're gonna have this transmission. What you're hoping is that you will have enough immune system, whether via means of a vaccine or herd immunity or any other kind of immunity that's gonna protect you. But we are not at that stage. And young people get in trouble and young people die. The other thing that we understand also is that the sooner you get treatment, the less likely you are of dying. A couple of days ago, I had a gentleman that came to me with 2.5 months of symptoms. He had refused to seek medical attention. And when he came to me, maybe his COVID itself wasn't that active, but his heart function was almost non-existent. His heart was so damaged by the COVID and the lack of him seeking medical attention that that was getting him into real trouble. Had I seen that man 8 weeks ago and we had started him on the Math Plus protocol, more likely than not, that gentleman would not have ended up with a very poor functioning heart as he did when he came to see us.
And how do you think it's possible in a city like Houston to send the message to, if you get any form of symptoms, get tested, get treated early, go to see your doctor as soon as possible?
It's almost impossible. I mean, social media has helped us a lot. I do a lot of media stuff. I've been interviewed by a bunch of different, TV channels and stuff like that. And my message continues to be the same. I tell people that, testing and retesting extremely important. And if you have any symptoms, you have to be seen. You have to be seen. Whether you're going to do it telemedicine, whether you're going to do it via phone, whether you're going to do it face-to-face, if you have symptoms, you have to be, because people are dying. And there is no need for them to die. Again, we have options to treat corona. And we have shown it with the Math Plus protocol. At least it treats the effects of the virus. It may not kill the virus itself, but it may stop the effects of the virus infection. So that in of by itself helps. But if I don't get you on time, I'm not going to be able to help you.
You emphasize that we don't necessarily have to die from it. What has been so far the kind of success rate you have had with you dealing with sick patients?
Well, we have been very fortunate, and our success rate in the last 8 weeks, having treated more than 60 patients in the hospital, it's 100% success rate. 100% success rate. Having said that, my colleagues in the medical center in Houston, they don't have the same success. They have a very high mortality rate. But, like I said, I like to get them early. The earlier I get them, the better off we are.
And you have a ward that is for sick patient, which is not intensive care, and then you have intensive care. What is the balance between the two?
Well, I mean, in this day and age where we are so swamped with patients, especially the last week, I have seen a surge in cases. despite of what some of the TV stations say that that we are having less cases, we are seeing more cases. And I don't know if we are seeing more cases because we're becoming a center of excellence for COVID, or because there are more cases. But I am attributing that to the fact that we have opened the state back, and the economy is coming back, and people are going out, and people don't seem to care what's going on. They go to the beach, and they go to bars, and this social distancing is not occurring. So I believe that that's why we're seeing more cases. So sometimes I have to allocate beds that are not meant to be ICU, and I turn them into an ICU. I created a COVID unit in which I have 20 beds for ICU, and then I have 26 beds for kind of intermediate care. But sometimes they overflow from one side to the other just because I get too busy.